Hope everyone's enjoying lunch, and you can go ahead and continue to enjoy lunch as we get our program started. So welcome to CDC. I'm Judy Monroe, President and CEO of the CDC Foundation, nonprofit arm that helps support CDC and public health around the country and around the world, and an IWF member. So it's delightful for me to welcome all of you. What I'd like to do is bring up IWF President Susan Bell to give some welcoming remarks.
Thank you, Judy, and hello and welcome everyone, both here in this beautiful facility, as well as a number who are live streaming with us on Zoom. So welcome everyone here today. Just wanted to share tremendous thanks to Judy as our host and IWF member, and to Dr. Walensky and all of the team that Judy and team have compiled here today for a fabulous program. But before we begin that program, I have just a few announcements and reminders to share. First, I want to thank our Dine Around hosts this spring for the wonderful dinners and outings. We had record attendance in this year's spring Dine Arounds and great feedback on the variety and the experiences. So many thanks to Kari Ariola, Beth Chandler, Sharon Gay, Lonnie Wong, Virginia Hepner. I hope I'm not missing anyone I'm sorry, who was that? Someone else. No, for hosting this spring. Thank you also to Chris St. Clair for hosting our President's Council just recently for a great get together of fabulous leaders. We're also looking forward to September Dine Arounds and looking for volunteers to host there. So you can propose unique cuisines or experiences, or just host a simple dinner around your table at home that fits 8 or so for an intimate dinner. Those are always favorites. So please let Nancy Zintak, who couldn't be here with us today, or Jennifer Langley know if you're able to host. Thank you also to our Fellows Committee, and I think Claudia also could not join us today. And to all of you who have nominated fellows for this year. As you know, that's an evaluation process that happens locally, and then we nominate globally. And then we hope that IWF Global will accept our proposed candidates. So we'll be announcing that later this summer as that process unfolds. Thanks also to our engagement committee, the Community Engagement Committee subset led by Glenda Minkin and a team for launching a round of community engagement opportunities. This was in response to member survey feedback, asking for more opportunities to get hands-on, to give back, and to get to know each other. I've heard great feedback from those who've attended. They've been fairly small and intimate gatherings, so it's sort of like a dine around get together, but doing work and giving back rather than just eating and sharing with each other. And there's one more of those coming up on the calendar. That is next week. It's at the Helping Mamas organization, which I think is a great way to honor Mother's Day this weekend. By volunteering this group, they receive and warehouse and then donate baby essentials to moms that are in need. As volunteers, our group will be warehouse warriors, assisting with general warehouse work such as processing donations, inventorying, sorting, shelving, that sort of thing, all while getting to know each other. That's next Thursday, May 18th at 10 a.m. And sign-up links were in our last newsletter. If you need something, reach out to Jennifer or one of us today. Also be on the lookout for an email for fun casual meetups or happy hours this summer. Nancy Zintak, again, is the ultimate summer happy hour planner, and she has a long list of great ideas coming. So look for those emails. Following the summer outings is our first fall member program, and it has a new date. So that's what I want you to save your calendar on today. It's now Friday, September 9th. And this is a luncheon field trip. And it will be a visit with Dan Cathy and a behind the scenes tour of Atlanta's top film studio, Trilla Studios. And I saw Liz Blake earlier, and I know that you had a big hand in getting this set up. So thank you for that, and look for the emails and information for that. And then also finally mark your calendar for our annual meeting and member program, which is Tuesday, October 10th. That will be hosted by Lee Zach and Elizabeth No at Agnes Scott. And the topic for that event will be female entrepreneurship. So again, look for more details about these programs by email. With that, I'd like to get back to why we are here today and again, formally recognize Judy and her team and her leadership for coming up with the idea of this program and taking it all the way to execution. For those that don't know Judy, she is Dr. Judith Monroe, President and CEO of the CDC Foundation, which serves as a strategic partner to CDC for global health security. And she's dedicated her career to protecting people and saving lives. This is on your table. I call it the cheat sheet of bios for today. So just to suffice to say, she's made a tremendous difference in a storied career advancing public health. And we thank you for all you've done and welcome you back to introduce the rest of our program. Thank you.
Well, thank you, Susan, for your leadership of IWF. And again, thank all of you. And I do want to acknowledge everybody on Zoom. I think we've got quite an audience on Zoom, I understand. So next on our agenda, we're going to hear from Dr. Rochelle Walensky, CDC Director. And you can read about her. There's a short bio. There are much longer bios. You probably read about her in the news, I would imagine. But you know, she's an influential scholar who's had great impact through her research on the advancement of care and the response to both HIV outbreaks and the pandemic of HIV here in the United States as well as around the world. But she was happily leading infectious disease at Harvard and got a call at the beginning of the Biden administration. And so she has been the CDC director. She answered that call and came in during an incredibly challenging time of our country and probably the most challenging infectious disease response that we've known throughout the history of mankind. I remember telling Rochelle when I first met her, I've known a lot of CDC directors. I've been really privileged to have met a lot. And I remember telling her, Rochelle, you have taken over the helm of CDC during the most challenging time of any CDC director in the history of the agency. And I know I'm not the only one that has told you that. And I was just talking to her earlier. She said, she's been with the agency 3.5 years. It feels at least 2.5 years, feels at least 3.5, because that first 12 months was at least double time, if not probably more than that, given the response. So she is CDC director, also the administrator of the Agency for Toxic Substances and Disease. Is it repository? Is that the name of it now? Registry. Oh, I can't read my own writing. I was going to say that didn't sound right at all. But anyway, you're about to hear from a remarkable leader, an amazing individual. So Rochelle, with that.
Thank you. Is it on? Yeah. Thank you so much, Judy. And good afternoon, everyone. Welcome to our Royal campus. Thank you for that beautiful introduction. I'm delighted to welcome you here. I have been asked to start with a few anecdotes of sort of what it has meant to me to be a woman in medicine. So I'll give you 2 or 3 of my favorites. They'll be quick, I promise. The first is, I think I was an assistant professor at Harvard, and I was like writing grant after grant and trying very hard to make it, if you would. I got this call asking if, like, 2 weeks from now, I would give this podium presentation, which I was super excited to give at a premier meeting, because they need a woman on the podium. And I remember being so angry that was the reason that I was getting the call. And in fact, that this gentleman would admit so. Then I decided that was going to be the best talk I ever gave. So I didn't take the opportunity to say no. I took the opportunity to say yes, and to say that this is going to be the best talk I ever gave, so that the next time you're going to invite me for me, and not just because I have 2 X chromosomes. That kind of worked, actually. I really really seized that as an opportunity to sort of say my message and to demonstrate that I was the one that they wanted and it wasn't because of my gender. The next one is, and maybe some of you will be able to relate to this. I was on a diversity committee for Harvard Medical School. This was after there was a bit of a scandal that women couldn't do math. You remember that scandal at Harvard? Yeah. So I got called to be on that committee to try and fix that image. And my phone buzzed, reminding me that I had to go to a different office building for that committee rather than the one I was usually go to. And my son saw that my phone was buzzing and said, well, what's that mean? And I said, well, I have to go to this diversity meeting. This was my eldest son. I have 3 boys. He was probably 7 or 8 at the time. And I said, well, what do you think about me that makes me diverse in Harvard Medical School? And he looked at me and he said, you are very tall. And that actually said to me in that moment, aside from the fact that I needed some education to do with my child, was that he didn't see it as an issue that his mom worked, that he saw that as the norm, which I think that gave me a little bit of grace, because I so often had surrounded myself with moms who didn't work and children whose mothers didn't work, and that was his norm. And maybe fast forward to last week, my youngest son, 18 now, just graduated. He's a freshman in college. I did tell him that I had made the decision to step down. And he said, I've never had an unemployed parent. So, you know, as I provide these anecdotes to just sort of say, in opportunities where it might have been easier to step back, or I have intentionally chosen not to, and I don't exactly know what my next chapter will be, and I'm looking forward to a little bit of downtime, but I suspect that will get old pretty quick. And I look forward to being a champion of all the work that we are doing and continue to do. I will just sort of recount the call that I got that Judy sort of alluded to, and that is that first year of the pandemic, is so hard as the last 2.5 years have been, and so rewarding as the last 2.5 years have been. That first year of the pandemic, I spent as the chief of the Division of Infectious Diseases at Mass General, and during that time was really the period of fear. Patients who were coming in, they were presenting in ways we hadn't seen before. We had a morgue that was parked outside of our hospital. We had, you know, a lot of uncertainty. Our own colleagues were getting sick in the ICU, and it was really a really challenging, difficult time for that first year. And in the midst of it, I remember being gowned and gloved in a patient's room, and my son called and said, Biden won. And then a few weeks later, I got a phone call from a 202 number, and the message, I was out of the office, the message said it was Ron Klain. And then I Googled, I was like Ron Klain, like the Ron Klain. So I called him back, and actually I didn't call him back yet. The first thing I did was I called my husband and I said, I think Ron Klain called me. And my husband, to his credit, because he knows me very well, said, whatever he asks, don't say no. Just say you'll think about it, whatever it is. He was right, because I might have said no if I hadn't been prepared for that little pep talk from my husband. So I did get this phone call that I never expected, asking me to consider the position as the director of CDC. And one thing led to another, and here I am. And this has truly been the most incredible privilege that I'm certain I will ever have in my professional and even personal career. I thought I would give you a little bit of background on where you're sitting right now, and that is CDC on our Royal campus in Atlanta. 1942 was when the United States Public Health Service set up a malaria control and war areas area here in Atlanta, partially because we needed to be near military bases, and there was concern and even some outbreaks of malaria, and the plan was to have the Public Health Service do these investigations near military bases here in Atlanta. And then ultimately in 1946, we became the Communicable Disease Center, and that is the first time you will ever see CDC, the acronym CDC, appear, as 1946, with Atlanta set up as the headquarters. We have a lot to be thankful for with Robert Woodruff, who then negotiated with Emory University to sell this land, where we are currently having lunch, to the CDC for $10, and that has become our Royal campus. I will say you probably haven't yet had a chance to walk around our beautiful campus, full of like incredible buildings, beautiful sites, and in fact, amazing science that is happening in the walls of it. But what I will say to you, and I had appreciated this, although maybe not to the, certainly not to the extent that I have over the last 2.5 years. We have, I will be visiting our Chambly campus this afternoon. We have a Lawrenceville campus. We have a campus in Puerto Rico and one in Fort Collins and one in Spokane, Washington, and one in Anchorage, Alaska, and one in Puerto Rico, all over the country, actually. And I've just listed the ones off the top of my head. We also have 60 sites across the world. We are in 60 nations across the world. And I do think that one of the golden jewels that is under appreciated of CDC is the work that we do globally, and how so much of our global health security in this country, around the world, is due to the incredible work that is happening on the ground in global health. I met this morning with our colleagues that are on the ground in Equatorial Guinea, fighting a Marburg outbreak there right now, as well as in Tanzania. Spent a lot of time several months ago, of course, in the Sudan Ebola outbreak in Uganda. And really, I think there's so much that we have to credit with our CDC offices for people who are living around the world. And I had the great privilege of going to Thailand several weeks ago now, where we've had an office there for 43 years. And it is really because of the work that we've been doing in HIV and PEPFAR that allowed them to leverage that work so that they were well prepared for COVID-19, both in our training programs, but really in our laboratory programs as well. While people know us as sort of the work that we do in outbreaks, infectious diseases, this last year I have sort of joked that it's been raining infectious diseases between COVID-19 and then Mpox and then paralytic polio and then Sudan Ebola. And of course, now we're spending a lot of time talking about avian flu. I think people less recognize the work that we do in chronic conditions, whether it be in cardiovascular disease, tobacco cessation, obesity, opioids, mental health, and then of course a lot of the work that we do in workers' health as well, important work in workers' health. People have asked about those missions and where they intersect. There are so many examples of where they intersect. Some of the ones that come to mind are when Zika was a big challenge in a vector-borne disease that affected newborns. You really do need the complementary expertise of both the Division of Birth Defects as well as our infectious disease experts to work on that space. When we have an EVALI outbreak, an outbreak of lung injury associated with e-cigarettes, it is our epidemiologists that do outbreak investigation that understand and work and understand how to do the outbreak investigation in EVALI. So in my mind, it is a no-brainer as to how complementary this work is. These last 3 years for the agency have been hard. There is no question about that. And though it is hard to imagine how we talk about successes in the context of 1.1 million lives lost, I do think that we should at least consider what we have been able to accomplish as an agency during that period of time. And just in the last 2.5 years, we have put 673 million vaccines into Americans' arms in this country, which is truly extraordinary. Thank you. To the CDC. We have made COVID tests available in every single household. We have had the ability to have a vaccine within 5 miles of anyone in this country through retail pharmacy programs. And there are so many more examples of this. So I do think that we need to not only recognize the tragedies that have happened during the course of this pandemic, but also raise up the successes, without which we would have had much more tragedy in my mind. CDC is, in addition to the work we do in public health, I do want to just sort of talk about the work, the impact that we have in local Atlanta here. We are 12,000 employees strong. These employees deeply care about public health. And one of the things I have said is, in academia, people get credit for having their name on a poster or a name on a podium, and they give a talk. There is not that much of that here at the agency. The credit that you get is that you sleep well at night knowing that you help somebody else whose name you will never know and they will never know yours. It is the quiet work of people who stay up all night so somebody else doesn't have to protect others. And that is the work of the people of this agency, 12,000 people and another 10,000 or so contractors. We are one of Atlanta's top 15 employers. And if we were a company, we would have an operating budget that would rank 107th on the Fortune 500 list. So really, we are a huge agency with a large budget doing, in my mind, incredible work. Maybe I'll just close with a few minutes on some of the things that we've learned over the last several years. I talked a little bit about CDC's history. What people don't actually put together when I could talk about that history is that the last pandemic, the last global influenza pandemic was over 100 years ago. And that means that CDC in its 76-year history have actually never had to deal with a pandemic of the size, scale, and scope of what COVID-19 delivered to us. In that context, we had a lot of work and some of great things that were happening, but also a lot of things and lessons that we have learned along the way. We have always been an exceptional science-based agency, and I like to joke when my MGH office in Boston, if I put C in the Google bar, CDC came up. So I was always a big champion of CDC and I'm always a big advocate of the work that was being done here. In CDC, in moving forward, and some of the things that we learned is that while we are a science-based agency and an exceptional one, we also need to be a response-based agency. We need to be the FEMA of public health. And we haven't had the capacity to be able to be the FEMA of public health because of many of the authorities and restrictions that are put on how we operate, how we hire. I like to give the example that we can send somebody to an Ebola outbreak in Uganda and they will not get danger pay. It's pretty striking in terms of the sort of human resource authorities that we have with us. In terms of our moving forward, we learned that we need to deliver our science faster. Science is being delivered faster in the context of health and public health in ways that we can't just wait for publications anymore, that we have to take that science and implement it into guidance that can be implementable across the nation. People have said to me, well, we didn't like this for this setting in New York City. And then, when I say, but our CDC guidance has to be implementable in New York City and in rural Texas and in Navajo Nation and in Alaska and in Guam. That's the vision of our guidance. And so then it all of a sudden is, okay, so we need to give people options about how they implement our guidance because every setting is going to be different. We have learned about how we communicate. For many decades, we have been communicating to our public health partners, to our academic partners, people who understand and are consumers of science. During this pandemic, we had every American coming to our website, our 200,000 web pages of website. And so we have a lot of work that we need to do to be accessible to the American people and to also be accessible to our public health and healthcare partners who really need the scientific expertise. And then finally, really, we need to, well, we talked a little bit about being a response-based agency and having a network of workforce that we are able to respond quickly. The final thing I would say is to just be a good partner. And we spent a lot of time and energy across the agency just listening more. What does it mean to be a good partner in a time of crisis? What does it mean for our partners in public health, whether it be our laboratory partners or our state and local epidemiologists or our state and local health officials, but also industry partners or partners with academia or partners with foundations or partners with medical societies. And how can we spend a little bit more time listening to what they need so that we can actually come together and collaborate? And that is a lot of the work that I'm really proud. We launched last August and is ongoing as we speak, and I know the agency will move forward. So with that, I just want to say, welcome to all of you. Thank you for being here. Thank you for being an incredible network of women across this community. And I look forward to the afternoon. Thanks, Judy.
So Rochelle, I think we're all very happy you said yes to Ron Klain. And you have a very wise husband, it sounds like, as well. So at this time, we're going to have a panel discussion. So I invite our panelists to come forward, and we're going to dive a little deeper into the women in leadership roles here at the Centers for Disease Control and Prevention. Okay, so we have a panel here, and we're going to have each of them get a chance to say a few words here in the beginning, but let me quickly run through. So in order here, we have Sherry Berger, who's currently Deputy Director for Policy Communications and Legislative Affairs and the Chief Strategy Officer here at the Centers for Disease Control, but she's held other positions like the Chief Operating Officer and the Chief of Staff. She's been very busy and been here a few years. Next to her is Deb Oury, who's also an IWF member and is currently the Deputy Director for Program and Science here at CDC and the Chief Medical Officer. Next to Deb, we have Karen Hacker, another IWF member. And Karen is the Director of the National Center for Chronic Disease Prevention and Health Promotion. And then last but not least is Dr. Les Dauphin, Director of the National Center for State, Tribal, Local, and Territorial Public Health Infrastructure and Workforce. So you can see between this panel, there's a lot of work that's being done on behalf of our nation and our world under their leadership. So I'm going to start with a question actually for all of y'all, and we can go whatever order y'all want to go. If you want to go, Les, do we want to start with you and move this way? First question for everyone is just tell us a little bit briefly about your role and the work here at CDC, and then briefly share some of the experiences that actually led you to your current role. How'd you get here?
Great, thank you for the question, Judy. So I have been at CDC and in public health for about 23 years now, working at the agency. And I'd say for the past 10 years, I have been in leadership roles either at the center level or at the office level. So that sort of guided me towards the role of being a center director. As center director, I would say my biggest responsibility is providing the strategic direction, leadership, and managerial oversight for my center. I lead a moderate size center, so about 1,500 staff. So having a fantastic leadership team in place is critically important and a big part of what I do in my role.
Very good. Karen?
So as you heard, I lead the National Center for Chronic Disease Prevention and Health Promotion. I've been here almost 4 years, it'll be 4 years in August. And my prior position was as a health department director at the local level. I was a county health department director in Allegheny, Pennsylvania, Allegheny County, Pennsylvania, which is, you probably have heard of Pittsburgh. That's the larger city there. And then before that, I was really working at the local level in public health and public hospitals, in research that involved community engagement. And my specialty is actually in adolescent medicine. So I had done a fair amount of clinical work in that arena. But I think at this point, after being a health department director, did that for about 6 years. And when this opportunity arose, it sort of seemed like the culmination of a rather long career. Hopefully I will say I'm older than I look. maybe not. Depends on who thinks, on who's looking, obviously. But the opportunity, I think, to work at the federal level, and in many cases to be now the purveyor of a fair amount of money that as a person in the field I was often applying for, was an opportunity I just really could not say no to. And it's been a very fascinating experience. Obviously, to some extent, I'm not a very focused on emergency stuff. She is, but not me. So I like the chronic disease. I wanted to be a little bit more behind the scenes, but came to CDC at basically shortly before the pandemic showed up, and found myself also involved in the Ebola outbreak, which was the lung damage situation that happened from e-cigarettes. And with that, have learned an enormous amount about emergency preparedness. And really, I think those connections that Dr. Walensky spoke about between chronic disease in particular and infectious disease. So for example, during the pandemic, became very evident very quickly that having a chronic disease was an enormous risk factor for having a really bad outcome from COVID-19. And it was like, I would say like, oh my goodness, every single thing in my center, diabetes, heart disease, cancer, obesity, they all create enormous risk for the individual. And so that connection and recognizing that in any emergency, it is often people with these chronic diseases, by the way, that impact certain populations disproportionately already, who are the most vulnerable. And so I think a lot of what our center is focused on is doing our best to contribute to the improvement of these conditions and the prevention of them.
Hello. So I'm Deb Howery, and what I would say is I've been here about 9 years now at CDC, but I didn't think I would end up here in its role. I was a ER doc at Grady, and teaching in the School of Public Health and School of Medicine with Claire, and tenured doing research really on public health, the intersection of public health and medicine, and loved what I was doing. And the injury center director position came open at CDC, and that's to focus on things like firearms, overdose prevention, sexual violence, drowning, things that, although it might not sound exciting to you, were really interesting to me and preventable causes of death and injury. And so I met with Tom Frieden, interviewed with him, and he pretty much hired me during the interview. And I jumped and loved what I was doing for about 7 years until I got the call from Rochelle one summer to join her leadership team. And in this role now, I'm overseeing most of our national centers, our Office of Science, our publications. And it really allows me to look at how we translate the work we're doing in our centers, a lot of the cross-cutting work, and making sure we're communicating effectively to the public. And I do like emergencies in ER, and I get bored easily. So for me, this is great because there's so many things like Rochelle talked about to focus on all times.
And good afternoon, I'm Sherry Berger. I started here at CDC in 1996, so this summer will be 27 years. This is where I make the joke. Yes, I started when I was 12. I am older than I look, I know that. So I started as an epidemiologist. I thought I wanted to have a career in science, and I was going to go to Emory and get a PhD. And after a couple of years, I decided that the other work here at CDC that supports the science was much more interesting to me. I've had a number of jobs. I led the appropriations work at CDC for several years, so working with Congress to secure funding for CDC. For 10 years, I served as the chief operating officer, so I oversaw HR, IT, all of the money coming in and going out the door, as well as safety, the security, and these facilities. After that, I served 2 years as Rochelle's chief of staff, and then recently moved to a new position, deputy director, as Judy said, and this is a new position here at CDC to help better align the support functions of communications policy and legislative affairs. So I'm standing that position up right now and excited about where it takes us.
Very good. So Les, I'm going to come back to you now. So you've heard from Rochelle. Rochelle came in during the pandemic. The agency was under quite a bit of pressure, I would say, certainly in the news every day. And so certainly the pandemic took a toll on all of us. So what was it truly like working inside the agency during this time? challenges, lessons, anything you want to share?
Yes, so it's kind of hard to believe that that was a couple of years ago, but during the pandemic, in the very beginning, when we recognized where we were, I had the pleasure of serving on the response in a leadership capacity. So I didn't mention in the intro that my background, I was trained as different from this group. I was trained as a laboratory scientist. So my training, I have a PhD in microbiology. So I used to be a lab rat, could live in the laboratory for hours and hours and in the high containment labs. I want to work with the things that are scary to most people. And so I have found that in my career, I tend to move towards the crisis or the emergency. I also have a military background, so I've just been in crises for most of my adult career. This was a crisis, and so I had an opportunity to serve in a leadership role on CDC's initial incident management structure for the response. So the challenges during that time was the incredible dedication and time it took for our staff. We were simply working around the clock and leading a team of staff who were so committed and really wanted to give their all and give their heart to address questions that we quite frankly didn't have the answers to, or to support the communities, to support the state, to respond to lots of questions. It was extremely challenging to encourage them to stay the course, but also to take care of themselves. I mean, really, we had employees working around the clock. So I think the challenges was the amount of commitment and time and dedication, and also managing and balancing that with the resilience of our staff so that they could take care of themselves and their families.
And Sherry, you were both chief operating officer and then became chief of staff during the pandemic. What would you add? How was it in the agency?
I think I would concur with everything that Les said. I think I had been through Ebola, through Zika. What was different this time was the connection for all of us. This was not something we were addressing around the globe. This was happening to all of us. And that balance of working so hard and then going home and working so hard as you were balancing your families, your friends, and their need to support one another during the pandemic. So I think that was what was different for us. The other thing was we are 22,000 people around the world. So I was chief operating officer at the time, and just how do we get 22,000 people connected from home, right? From around the world. So we had to change our entire operating model, and we are the federal government. Nothing happens quickly or easily. So there were a lot of very sort of logistical, tactical changes that we had to put into effect very quickly.
Okay. I'm going to shift topics here for a moment. And all of you probably heard in the news last week that CDC lost a colleague, Amy St. Pierre, from a firearm injury. Deb, I'm going to ask you this question. You've been an injury, you've dealt with these issues. What about working on topics that are polarized and politicized, and that would include violence prevention and firearm injury and so forth?
So I've always felt that these, and maybe it's naive, but shouldn't be political. You know, when you look at what are the leading causes of death and injury, and you look at firearm violence in our country, it kills over 40,000 people. And so for me, when I've met with our stakeholders, with congressional members, family members, patients, you know, I talk about the data, but also the stories. I try to personalize it both as an ER doc, but also as a mom of a teenager. And I have found that if you go too far one way or the other, people aren't going to hear you. You have to meet people where they are at. And I think for me, one of my big moments was, you know, getting funding under President Trump for firearms. And a big, I'd say, person behind that was Senator Isaacson. He was willing to listen. And we had a very informed conversation and talked about how it wasn't mass shootings that were driving violence. It was suicide, it was homicide, and things we could do that we could all get behind, like safe storage, more research, data collection. And so with that, I think it's, again, just keeping it focused on so people can hear you, pairing that science with the personal stories, because I can talk till I'm blue in the face with bar charts, and it's not going to convince people. But if you can do the objective with a little bit of the personalization and bring it home, I feel we can really move things. And I am still optimistic, despite the rising rates in our country, that there is something we can do.
Sherry, anything to add from your perspective?
I
Policy.
would just say that the COVID pandemic, for many of us, has emphasized the mis and disinformation and how that also impacts what Deb described. And I think vaccinations is probably a really good example, and how important it's been for us with community health worker program, which was something new that we've been able to initiate, that we need to identify people who work in communities and support the people that live there, and find those messengers, those trusted messengers, to help us address some of this mis and disinformation.
So Karen, I'm going to move the next question to you. Speak to us about the important role of public health workers during these trying times. How can these leaders in public health enhance public health messaging around things like screening, vaccinations, all of these things that we know from science save lives, but there are forces against these.
So especially coming from the field and living through what happens when there's an emergency and you have to figure out how to really quickly respond in a coherent manner. I often saw public health authorities as really being translators, trying to translate pretty complex concepts into something that the public felt confident in, trusted what we were telling them, whether it was an air quality emergency or an infectious disease emergency or a hurricane or whatever it was, because oftentimes you're asking the public to take action. And they're not going to do that if they don't believe what you have to say and they don't understand what you have to say. And I think in this pandemic, between the political nature of things that sort of occurred, I think it's been incredibly difficult on the field. We've seen enormous shifts and changes in health department leadership across the country at both the state and the local levels. We've seen people who are absolutely exhausted. The pay scale, I got to tell you, it's not so great at the local level either. So, you know, how long do you want to do that and potentially get death threats or other kinds of things that are going on? In addition, I think it's important to understand that the public health infrastructure had already been seeing a dismantling, if you want to think of it that way, prior to the pandemic. So there was a loss of resources going into public health already. And now you end up with this pandemic, with this expectation that they will rise beyond to the occasion that they're under. And now as we come out of this, there's been a huge amount of money, as I'm sure you know, that has gone into the field. Many times states and locals are not even really equipped to figure out how to spend the money, how to get it out the door, how to get it into the hands of the community health workers and anybody else who they need. And now we're sort of reaching a cliff in a way with some of those resources too. So I think the field is going to emerge from this, but the question is, will they be able to be stronger than they were in the past? Will the support continue for the public health infrastructure? Do people understand for the first time, hopefully, what public health actually does? Because I will tell you that we used to say in public health local, which is nobody knows when you're doing your job because you're doing it well. So there's nothing for them to really complain about. And it's only in these kinds of situations that people then describe you're not doing your job the way that they might want you to do. So I think there's a huge amount of work that we're now engaged in, I think at all levels of the agency, in trying to figure out how best we at the government level can really support the health department workforce throughout the country.
Deb, anything to add to that?
The only thing I would just add is I think, you know, like what Amy and I were talking on the break, I think this is where we really need all of you. This is where we need community members to share CDC's messages, to carry those. People see us, they see we're from CDC. You have family members, you've got community groups. We need you.
Very good. So this question is actually for all of you. So describe some of the challenges you faced, especially as women in leadership and in science, and how'd you overcome the challenges? Karen, we'll go to you. We'll mix it up.
Well, I will first pay some homage to my mother, who is also a physician. And I always figured that in comparison to what she faced becoming a physician, I didn't have anything to worry about. But I think for me, it was always being in a scenario where you were one of a minority. And I say that from the perspective of, how many people were in my residency. There were 4 women in my residency out of like 28 women. When it came to, I went to college in what had historically been a male college. And so there weren't that many women there in comparison. So I was kind of used to performing, I guess I would say, in a male dominated environment. But I think the thing that I realized over time in particular, and as you can probably tell, I'm a pretty energetic, kind of passionate individual. And if anything, I think for me, it was always feeling like I was being discounted in terms of my knowledge area because I didn't necessarily conform to the idea of what a woman in science should look like, perhaps. And I guess I'd stop there.
Les, how about you?
Yeah, I think I'd add to what Karen said, and I would say even more so in my career, probably most parts of my career, the biggest challenge has been, I would say, being maybe perhaps underestimated. I use that word because I think about, I'm going to go back a little, but it does relate to recent experiences. I mentioned that I had a background in the military. And so I served in the US Army during Operation Desert Storm. So I was actually deployed to Saudi Arabia during a war. And there were no females doing that. And my soldier colleagues who were male did not understand why I was there and what I was doing, and certainly didn't think I could do what they did. And I couldn't, but I could do my best. So overcoming being underestimated. Shifting to now, I would say when I went to graduate school, very much like Karen mentioned in her training, there were not very many women who were majoring in microbiology for a PhD program, and certainly not any women of color. In fact, I was the only woman of color in a PhD program in microbiology. And I would say that overcoming the feeling of being maybe underestimated or having colleagues or peers who don't necessarily understand why you're there or that you are able to compete or to be productive or to perform is a challenge, very much like I reflect on the anecdote that Dr. Walensky shared about being called to do something because she was a woman. I've had those kinds of calls before and always accepted the challenge. The answer is almost always yes when I'm called to do something. And I'm going to try to do my very best. So being prepared is probably one of the best ways to overcome that experience.
Very good. Thanks, Les.
I think for me, similar to, I think Karen, some of the med school, and I went into ER, the very male dominated, 20 plus years ago. I think back to some of my early experiences and I learned that I had to be both persistent and resilient. The thing that I finally told this one editorial board just a few years ago was when I was a resident, I applied to be the resident member of their editorial board. And the editor-in-chief pulled me aside. He actually embarrassed me. He told me I was young and I should focus on being more balanced and having a family. And I was not going to cry there because you don't do that, even though you want to. And I was really pissed. And one of the other editors pulled me aside and just said, we're going to make you a peer reviewer. I'm sorry, we'll work with you. And I could have just, walked away. The next year, because I am persistent, I did apply again and I put in there, if my age or other demographics will restrict me from doing this, please let me know before we go further in the process. And they did take me. And I ended up being on that editorial board for 20 years. And I shared that story with them just a few years ago. And I just said, my career could have gone a very different path if I had listened to that man, when he told me to do something different. So I think for me throughout, you get knocked down sometimes, but you get back up and you become more resilient. And I think as a female leader, we have to embrace who we are and be authentic leaders. It's okay to be vulnerable. And it's okay, I think, to lead differently, sometimes, with more emotional intelligence or just different. And that's what I've learned, I'd say, over the years, including through this academic leadership program that Claire Stirk had run at Emory. That gave me a lot of the competencies needed and the confidence.
Sherry?
Well, I'll be short. I've been fortunate. I went to graduate school for public health and I came straight to work at CDC, which is predominantly women. So I have been lucky enough to be in a work environment where women support each other. I think for me, the balance has been more of the outside of the office, which I'm sure many of you here have had those same challenges throughout your career, and prioritizing and trying to be everything to everybody all the time.
Very good. So we wanted to leave some time actually for questions from the audience. So if you do have a question, we've got a couple of mics set up. Please go to the microphone. Let us say your name and who you want to direct the question to.
When I went to the CDC, and I'll put my journal in I actually still don't know. And I don't believe that insult, please don't take that as an insult. What I want is more transparency. Because I don't understand how what you do, I did during COVID, and congratulations and thank you. I don't understand, like when you say you study this and you study that, you study gun violence and you study infectious diseases. How does that come back to me? How does, how do you affect the world? I get when you send people out to figure out an outbreak of listeria or what, okay, you say that's this and you've identified it for us. But beyond that, it's odd. It's when I hear you talk, I hear it in very generic terms. And I think what I'd requested the CDC is to get very granular with your audience and very specific. If you're studying gun violence, how does that affect me? What change in my life should that be? So it's a request, and I think an observation. I live here, and yet I don't think I know enough. And I'm saying that as somebody whose reporters interact a lot with you, and they get the information, but I still don't think we're breaking through. And I don't think that's an insult. I think it's just simply, for me, a fact. And I love for people to have more of a hands-on feeling of what you do.
Thank you for that question and the commentary about that, or the advice and request. Anyone want to respond to that? Karen?
So I do think one of the biggest challenges is that we are very broad. It is a very broad agency covering a lot of areas, but public health is very broad, right? But I also think that one of the things that I came to CDC for, honestly, was because we are a gigantic funder. We give the money out to the states, sometimes the locals, to actually do the work around diabetes, hypertension, cardiac disease, things like that. So if your state, in the area of chronic disease in particular, the vast majority of money that the state gets to do anything in chronic disease from public health is from us. We're the largest funder. We have national programs. But again, I think that, the point you're making is paramount, because if people don't know that the story's not out there, people don't understand. So. Yeah.
May I just add to that, because Karen and I actually talk about this quite a bit, as a funder to state and local public health agencies, when public health is working and protecting the health of communities, then it's less burden on our healthcare system. So if you want to think about it in those terms, individual health, going to see your physician, your doctor to get help, public health is dealing with communities. And so when that's protected, it's less burden on our healthcare system. I don't know if that helps, but.
I had a question for her before she exits and for all of you. Your question. How did you manage top overload of everything that comes at you as the head in the midst of chaos and still balance being a mother and a wife and stay sane? And then know when to step down, maintaining your brand that could have been destroyed by all kind of narratives. What narrative do you tell yourself?
First of all, I would just say that I have this incredible family. I really do. I'm really blessed. It's the only way that this would have been possible. My husband has been this incredible champion. But no, my husband's been an incredible champion of me in this role. And the fact that I was able to do it is much a tribute to him. My kids have kept me honest. My eldest son once sent me a quote of something I would swear I never said. And he said, no, I saw it in the paper. I said, what paper? I never said that. And he said it was in the Onion. So they sort of keep me sort of with a healthy sense of humor through all of this. I feel really strongly that you have to read the negative because you really do have to know and understand the scope of what people are being challenged with. So I do read that, but I don't read it at bedtime. My family has said that, and you know, as much as I've talked about my family, my new family here was really, really warm and welcoming. And as you can see with the women on the podium here, but also just especially at a time when the agency was hurting so much, there was a desire for somebody to come in who could champion and lead and sing the praises of the people who were doing the work. It made it very easy to do. I mean, you hear the work that they're doing, you know, 11 o'clock on a Friday night, somebody calls you and says SOS, and you realize that they've been working all day to not call you in the spirit of not wanting to, and then every hour. And so it really is, I felt it my job to sort of just let people know of the work that we are doing here on their behalf. And it's incredible people. As hard as the last 2.5 years have been in this agency and the year before it, this has been the biggest honor, the greatest gift, the biggest network that I will ever be able to say. So I have definitely received much more than I've given. Thank you very much.
Hello. Well, as the leadership goes, so goes the team. I'm very impressed by the talent that you have displayed in your comments to Judy's questions. It was authentic, it was moving, it was riveting. Now, my $1 million question. She almost took words out of my mouth. What is CDC? What is the story? What do you want it to be? Given the wealth of insight that you've shared, I believe there is more that can be told and is untold. I'm in the business of humanity. I run a company of humanity. And humanity is about Ubuntu. I am because we are. And I believe from the COVID, we are because you are. But we honestly don't know the back end. the hardware and the software that drives what you do, other than the free dinner that I had in Kenya with a CDC epidemiologist, she paid for it,
If I may.
or somebody that I met with. So I really appreciate that. They say I should keep it short. I really appreciate you responding to that.
I wanted to add, because I'm going to add to what she said and to what the first person said. My name is Monica Maldonado, and I am the president CEO of IPCOM, a creative communications agency. And I thought, as I was listening to you women today, that I grew up about this inches tall, because I was so impressed by the education that you have, and at the same time, the sentiment in which you express what you do to help us all, that I think that what you need to do is get on a roadshow to then answer the questions of maybe too many people don't know about the CDC, because you guys are all over the place, from an economic development wealth to what you're doing all over the world. So I am involved in a lot of communications and a lot of women empowerment. And what I felt today with the power of this woman panel, I think for real, a roadshow.
Hi, Amy Baxter, pediatric emergency doctor, and I'm currently funded by NIDA and NINDS with the HEAL program for ending addiction, creating devices using mechanical stimulation and cold to decrease pain. The thing is that CMS doesn't cover any of the things that the CDC's November 2022 physician guidelines for opioid prescribing recommend. So apart from opioids right now, our current system doesn't have a mechanism to support the things we're asking doctors to prescribe or to suggest. And still, doctors get 11 hours of pain education in medical school, and most of it's on pharma. So none of that's changed in 20 years. And just finding out that funding is one of the things that is a bedrock. Is there any way to overcome this gap in what we say we should do and what we pay for?
So, the Injury Center does offer grants specific to overdose and opioids. What I would say is we do work with CMS, we work with FDA. A lot of times when we're issuing our guidance, it's been done in partnership with them with the hope that they will implement what they are able to. Sometimes there's different levers. We have things like our Committee on Immunizations, and we also have our community guide, and those recommendations do get uptake through insurance companies. I hear what you're saying though about some of the more non-traditional modalities. Yeah.
Or yoga or.
And those, we've actually convened insurance companies, and that's something that has been done like through CDC Foundation as well, is to engage payers in a lot of this work.
Yeah.
Thank you.
Thank you. Time check. We've got the museum. Is that hard at 1:15 or do we have a few minutes? Okay. So let's take the last two questions and then we've got another treat in store for you if you can stay.
Sure. So I suspect each of your identities are steeped in science and medicine, given where we are. And, Judy, you touched on it, and I wanted to dig in a little bit more. It seems like the strange Venn diagram came out of COVID. You have science, medicine, and now politics. And so at a personal level, not speaking for CDC, I would imagine, and I would love to hear personal experience shares, like how did that affect each of you personally? I have to imagine the frustration, but I'm projecting my own stuff upon you. So.
I actually don't want to answer that question first, but I do want to exercise a moment of leadership. I'm going through a draw because I don't have my phone on me. Cheryl, could you let my 1:15 know that I'm going to be late? Sorry. Thank you. Okay. Thank you. Thank you. Okay. So
Very good.
sorry.
Deb, you want to take that one or Karen? Jump in.
Because I was who was talking about? So as a chronic disease center, we weren't as in the middle of all of this, obviously, as some of the other centers that were so focused on the infectious disease messaging. But one of the areas that was very challenging, particularly at the end of the last administration, was this the focus on health equity and disparities in particular, and how what the impact of the George Floyd murder was on certainly within our center, how important that was as as a center that focused on chronic disease. We have been dealing with health inequities for a very long time. A lot of our programs that are funded are looking specifically to support populations that has been historically underserved or who have borne a disproportionate burden of disease, right? But with George Floyd's murder and the opening of Black Lives Matter, there was sort of this amplification of things that we were able to do for the first time. And then at the end of the last administration, we were getting memos on a regular basis that we couldn't do those things. And that, as you can imagine, had an enormous impact on staff. One of the things, and this is my first time in federal government, that you begin to see is these pendulums that swing, and you go from one extreme to the other a lot of the time. One of the things I've always said about public health, though, when opportunity knocks, you better take that opportunity, because you do not know when that door is going to close. My hope always is that when the pendulum doesn't swing all the way back, but we gain and we figure out how to sustain our progress. Go ahead.
Hi, I'm Gulshan Harji. I'm a physician, graduated from Emory Med School 1982 and residency internal medicine 1985. I was born and raised in Tanzania. Went to high school in Pakistan, college in Iran, and arrived in the United States in 1979 during the Iranian embargo, and asylum seeker. In 1999, my husband, with 2 postgraduate degrees, was shot and killed in the Buckhead shootings, senseless gun violence. Overnight, our life went upside down. If we're thinking, when's the next pandemic coming? We are in a pandemic. The gun violence situation in our country is out of control. There is not a country in this world that lives in fear like we do. We don't have issues, sincerely, having lived in so many countries, we don't have the issues that other countries do, but ours is a serious situation. And I think it is appropriate for me to ask, where does the CDC stand on this issue? And I think it's a priority now. Since COVID is behind us, I'd like to know what your priorities are and what the CDC has in mind about gun violence. And I thank you.
Well, first, yeah. Thank you for sharing your story. I think you probably, saw the reaction from all of us, because each one of these lives that we lose is one too many. And I always remind people, these aren't numbers, these aren't statistics, these are lives. And in the ER, I saw it, and I did interviews last year as part of our vital signs. CDC, for the first time ever under Dr. Walensky's leadership, we did a release on firearm violence and what communities can do and what individuals can do. And I remember during an interview, I was trying to decide whether to share the stories or not, but I would have to change my scrubs when I came home because they were covered in blood, after working at Grady all the time. And I just kept saying, I don't want to talk to another parent, while covered in blood. And that was graphic, but it really brought home, what we can do to prevent it. And so at CDC, it took 20 years to get dedicated funding. We got our first dedicated funding in FY 2020. So we have a lot of time that we're making up for. We're fortunate and happy to have this funding now. Certainly we can do more with additional funding, but what we are doing is we have data collection in all 50 states to look at violent deaths for both suicide, homicide, as well as mass violence. We are then able to share what led up to those deaths, how we can prevent them. States have that data. We also now are looking at emergency department data for non-fatal shootings. We're able to then help communities respond when they have surges. We've actually done things called epi-aids, what disease detectives do. When we've seen surges, we're able to send providers to those communities. We did this in Delaware when they had a surge and looked at what communities were impacted. Was it violence interrupters? What programs did they need? And then we are funding now 20 research projects ranging from things like how do you intervene in 4-H safe shooting clubs so that kids know how to handle guns safely. I had heard from one of our grantees, they believe they prevented a school shooting because the kids knew what to look for. We have worked with veterans around suicide prevention, and we have also now worked with youth violence prevention centers in 6 different cities to where we're working in communities and interrupting violence. That's just the start. Certainly there's much more that needs to be done, but it has been a priority for us. Thank you.
So I want to, first of all, thank all of you for your insights and your questions and for pushing the agency on communications. When it comes to gun violence, as well as all public health issues, CDC can't do it alone, and public-private partnerships are key. I was just at a meeting last week with a number of CEOs of major international companies, and they are very concerned about the gun violence in the United States, what it's doing to the image of the United States or around the world. Other countries are worried that this could come to their countries. So the CEOs, we need the private sector to also step up, and it sounds like they're ready to step in a big way as well. But that's common among public health, these huge public health issues. I do want to thank you because I think that's been an Achilles heel for public health for years and years, how to explain it. All of you are here with a certain lifespan that collectively we have 30 or 40 years more life because of CDC and the work of public health. We didn't wake up this morning worried that we were going to have smallpox because that got eradicated, right? You're not worried about your grandchildren having Haemophilus influenza meningitis. When I was in my residency training, every single ER stretch that I had, it was one sick child after another. The vaccines were not just developed, but then what CDC does is deploy that and get that skill set out throughout the entire nation to get those kids vaccinated. You don't have to worry about that as a mother or grandmother today. So welcome. And at CDC Foundation, we actually are embarking on a journey of communications with CDC. We do need to figure out how to tell this story differently, because the impact that CDC, which is here in Atlanta, which does have a large economic footprint, by the way, for the state of Georgia, but we all should be very proud of CDC being here in Atlanta. And so let's tell the story better. Thank you. Susan, with that, I'll invite you up. Thank you to our panelists. Susan, close this out.
Yes, just real quick. Wow, thank you again. I mean, it may be difficult for us to understand. I think Dr. Walensky referenced 200,000 web pages. We know you have 15,000 employees. It's a lot that you're doing, but you all, you 5 are just tremendous leaders, and your insights are really special. And we will continue to try to understand more and try to share more and learn more. So thank you again. We also we also wish Dr. Walensky the best and appreciate her sharing with us today and her leadership in truly unprecedented times. All of you, I'm sure it's like dog years in terms of the amount of work that's gone in, and we appreciate that. Also want to quickly thank Amy Glennon and Program Committee. You knock it out of the park all the time. And thanks to Judy, I know on this one, for taking this all the way through. Thanks to Jennifer Langley at IWF and to Courtney here at CDC for all the behind the scenes work. And just 2 final reminders, membership nominations are coming up. Susanna is here as our membership chair. The nomination forms will be going out soon and will be open during the month of June, basically June 6th to July 3rd. So be thinking now and get your nominations in, and I thank you for that. And then finally, for those going to IWF Global Conference in Finland in June, thank you for representing us. Have safe travels, send us pictures, and thank you again to all of you today. We do have an opening now to tour the museum. Is someone going to share? Enjoy the museum. Thank you so much, Courtney. Thank you all. Safe travels, and thanks for all online as well.